Yes, Madam Deputy President, the question time today highlighted the fact that the Minister was now acknowledging the tragic deaths of some 457 people in our aged care facilities across the country. And what was particularly remarkable was that he said that there were 33 people that he didn't know about as the Minister, and this had to be reported. And as a consequence, that was, I find, quite an extraordinary proposition, particularly in the case where we're talking about Victoria, where I found out, checked today, my advice is that of those 420 Victorians in aged care facilities had passed away during this crisis. These figures, the Minister suggested, needed further work. The Victorian Age Response Centre and had clearly needed to do further work to reconcile the figures, he said. So the 420, the numbers that the Victorians are using today, stands in contrast to the 457 that the Commonwealth is still using. What's particularly of concern to me is that the deaths that have occurred, the tragic deaths that have occurred, have entirely been within Commonwealth-managed facilities. Entirely. There's been not one death in a Victorian government-run facility. Not one death. So all of these facilities have been in centres that you would have thought the Commonwealth would have had a direct line of advice on. Now, of course, the Victorian government government-run facilities are public facilities, and unlike the private ones, have mandated minimum staffing requirements. And so the question arises around quality, the questions arises around the deregulation of private facilities, which I think is at the core of much of the quality issues doesn't arise. Now, we know that many groups, public, private, not-for-profit, play a role in providing care for our aged Australians. But what is absolutely critical is that it's the Commonwealth Government that has overall responsibility, a proposition that the Prime Minister has acknowledged on many occasions. What, within that context, is a simple proposition. They set up a Royal Commission and has then sought to ignore that Royal Commission and the advice that that Royal Commission has provided to him in terms of its interim report, and as recently as the 24th of August, where the Royal Commissioners have said that currently the Australian Government has no care quality outcome reporting for its home care, and reports are only on 3 indicators for its residential care. And had the Australian Government acted upon previous reviews of aged care, the persistent problems in aged care would not have known much earlier, and have suffered for many people, would have been avoided. And of course, Senator Fierro Welch has been referred to today by Senator Wong in her question, made it very clear in her submission to the Royal Commission that the aged care sector is on the brink of collapse. And I quote again, there needs to be a clear direction for the government to stop tinkering on the edges to undertake real structural reform. The Coalition had promised real reform of the sector and regrettably instead had become a merry-go-round of ministers with a lack of stability, inertia and demonstrated by the aged care sector design and its operation. So by any standards, this minister, under previous government's arrangements, that is Conservative government's arrangements, should have resigned. But it's not just this minister that should be held in terms of his responsibilities here. The question of the role of the Health Minister himself comes into question. He's the senior Cabinet Minister. He's the Minister responsibility at the Cabinet table. And why has he left these vital tasks to the junior minister when there have been so many warning signs, so many examples of the failure, the neglect, the administrative neglect of this system, to the point where they don't even know how many people have died as a result of their failures. At every level, the Prime Minister, who's tried to dodge this issue, cut funding, pretend it's someone else's problem, as we heard yet again here today, try to blame somebody else, the Health Minister, the Junior Minister. This is a government that has resided over a tragedy, a shocking tragedy. This is a government that should front up to its responsibilities and should acknowledge that there needs to be
Senator
fundamental
Carr.
change
Your
in this
time has
approach.